Hello everyone, my name is Carrie and I'm going to talk about fetal alcohol syndrome and how it can affect students and what teachers can do to help these students be successful. Fetal alcohol syndrome is a congenital disability. This means that it is present at birth and it occurs before the child is born. The impairments caused by this disability are physical, mental, and neurobehavioral. Fetal alcohol syndrome is a permanent disability and affects the individual throughout their entire life. However, this disability is completely preventable. Fetal alcohol syndrome is caused by prenatal exposure to alcohol that only results when mothers consume alcohol during their pregnancy. It is important to understand that when a pregnant woman drinks, so does her unborn child. In addition to fetal alcohol syndrome, there are other related conditions that are classified under the umbrella term of fetal alcohol spectrum disorder. They include alcohol-related birth defects, alcohol-related neurodevelopment disorder, partial fetal alcohol syndrome, or fetal alcohol effects. These are all caused by prenatal exposure to alcohol. It is important to be aware of fetal alcohol spectrum disorder because it is the leading cause of cognitive disabilities in the United States. Over 40,000 children are born each year in the U.S. with fetal alcohol spectrum disorder. This makes it likely that most teachers will have at least one student with this disability in their classroom at some point during their career. The number of children born in the United States with fetal alcohol spectrum disorder is greater than the number born with autism, Down syndrome, cerebral palsy, cystic fibrosis, spinal bifida, and sudden infant death syndrome combined. There are many factors that contribute to this epidemic, including the fact that about half of all pregnancies in the United States are unintended. There's a general lack of awareness or understanding by the public of this problem, and alcoholism is a serious disease that requires treatment. In women, they may be unable to stop drinking or unable to get help. Also, there are many misconceptions that are reinforced by our society. Some of the myths include that the science is unclear and does not really show that prenatal alcohol use is harmful, that moderate prenatal alcohol consumption is harmless, that beer or wine is less harmful than liquor, or that alcohol is less dangerous than other illegal drugs. These are all false. While fetal alcohol syndrome is only known to result from heavy drinking, fetal alcohol spectrum disorder can result from as little as 2 drinks early in pregnancy or from 4 drinks consumed at once. Therefore, no amount of alcohol is considered safe during pregnancy, as 12 ounces of beer or wine cooler, 5 ounces of wine, or an ounce and a half of liquor all pose the same risk. Also, alcohol is more damaging to fetal development than drugs like marijuana, cocaine, or heroin. Public awareness of fetal alcohol syndrome is raised through warnings from doctors, and the Surgeon General requires a warning label on all alcoholic beverages. However, there are no laws that protect children by prohibiting prenatal alcohol use. To correctly diagnose fetal alcohol syndrome, there are 4 key factors that must be identified. In addition to prenatal exposure to alcohol, they are facial abnormalities, as described in the picture, growth deficits, which could be height and/or weight, and central nervous system dysfunctions. Other physical symptoms of fetal alcohol syndrome include deformity of the limbs, hands or feet, vision or hearing problems, and organ dysfunctions, including the heart, liver, or kidneys. Fetal alcohol syndrome can be hard to diagnose for several reasons. While there are identified characteristics, there is no clearly defined model for diagnosis. Another key problem is that not all individuals with fetal alcohol syndrome look or act the same. Also, mothers may not want to admit to prenatal alcohol use. The cognitive deficits that are caused by fetal alcohol syndrome include things like impaired memory, difficulty grasping cause and effect relationships, the inability to follow multi-step directions, poor organization skills. They may become easily frustrated. They may have difficulty problem solving. They may practice poor judgment. They may have the inability to apply prior knowledge to new situations. Or they may have trouble anticipating the consequences of their actions. Motor functioning impairments caused by fetal alcohol syndrome include things like clumsiness, difficulty writing or drawing. They may have tremors, poor dexterity. They may have slow movements or delayed reactions. Studies have shown that behavior problems may be more common than academic issues. They include things like hyperactivity and inattentiveness, or the inability to pay attention, and these are two of the most commonly reported. They may have difficulty calming down. They may be easily distractive or overstimulated. They may be overly active. They could be impulsive. They may have trouble with transitions. They could be unpredictable or have aggressive behaviors. People with fetal alcohol syndrome may also have impaired social skills, and this could include things like an inappropriate choice of friends, a lack of stranger fear. They may be gullible or naive. They may have difficulty resolving conflict. They may be unable to conform to the expected social norms. They may have trouble understanding the perceptions of others, or they may have difficulty understanding sarcasm or jokes. Most students with fetal alcohol syndrome are in the mainstream classroom. Fetal alcohol syndrome is not formally recognized by IDEA, so students who do need special education services only qualify under a secondary diagnosis. This would include things like emotional behavioral disturbances, or conduct disorders, or ADHD. The needs of students with fetal alcohol syndrome range from academic to behavioral or emotional. It is important to recognize the differences in the needs and abilities of each student. Take the time to get to know each individual. Exercise patience and have tolerance for these students, as they can be very difficult to work with. Since the severity of fetal alcohol syndrome is different for each individual and students have unique needs and abilities, a variety of instructional strategies and accommodations should be used. They include things like giving personal attention, giving them frequent reminders of things like rules, appropriate behaviors, and staying on task. They may need constant supervision. You may need to repeat or re-explain your instruction even after it has been already learned. Give them extra time as needed to complete an assignment or task. And if time management is an issue, you can reinforce this concept through things like timers or using a stopwatch. Other strategies that can be helpful for these students include Things like introducing concepts in smaller, easy-to-understand segments, giving a demonstration along with a verbal explanation, encourage them to take notes or use a written planner, make sure they feel comfortable asking questions or asking for help, model the appropriate and expected behaviors, always hold students accountable for their actions, intervene quickly when needed if behavior is inappropriate, provide the students with frequent feedback, use positive reinforcement as motivation, and consequences, whether positive or negative, should be given immediate and should be logical for the situation. Using visual references can also be helpful for things like understanding abstract concepts, modeling behaviors, showing cause and effect relationships, representing skills or ideas, to display the rules, or for use as transitional objects. These pictures should be placed in close proximity to the student so they can use them as visual reinforcement. Students with fetal alcohol syndrome can be easily overstimulated, and environmental accommodations that can be helpful include things like providing structure, maintaining a predictable schedule, setting clear and concrete rules, maintaining overall consistency, have a neat and organized classroom, keep all materials put away except when they're in use, and avoid unnecessary stimulants or distractions. And this can be done through strategies like seating arrangement. You can place them in the front of the classroom. Never put them next to a noisy heat or AC vent. Never put them next to an open eye-level window. And also never place them next to a talkative peer. You could also use a study carrel or headphones to help eliminate these distractions. Social skills can be developed through things like role play, telling stories, having them work in pairs, which can also help them stay focused and on task, have them work in small predetermined groups with peers that best fit their needs, and also it is important to communicate with other teachers and parents to determine strategies to help them develop these important skills. With proper use of instructional strategies and environmental accommodations, it is possible for all students with fetal alcohol syndrome to be successful in the general education classroom. Fetal alcohol syndrome is a completely preventable disability, and teachers play an important role as education is key, and it should start with students, especially older students, because it is known that some teens are engaging in alcohol use and sexual activity. And it has been estimated that over 3 million teens in the United States between the ages of 14 and 17 have problems with alcohol. Ideally, it is possible to eliminate this serious and lifelong disability from our society. I want to thank you for listening, and I hope this helped you understand what it can be like to have fetal alcohol syndrome and what you can do as a teacher to help these students be successful.